Hi, and welcome to Coach Talk. We have been doing series after series with different guests, giving you some insight and awareness as to how to overcome some of the challenges that we're facing right now. I have a selected, guests that are coming in to keep their time and talk about different topics, which hopefully relates to you at some point. Today, I have a very special guest, a dear friend of mine as well, who is a multi-award winning dental surgeon, amongst many other things which she will introduce herself. And I'd like to introduce to you Dr. Yusra Al-Mukhtar. Thank you so much for joining me. It's such a pleasure to see you, and you're looking absolutely beautiful and wonderful as usual. Thank you for coming on Coach Talk.
Thank you so much for having me. It's an honor to speak to you. I've always wanted to have a good chat to you, so thank you for inviting me. I appreciate it.
No, I really, really am so pleased that you're here with me today. I have so many questions for you, and I'm sure that you've done this many times, but my show is slightly different. I know you do many things, so just speak to, just for the audience, can you like sort of summarize like the things that you do besides, the dentistry? Because I know you do so much more, and I just want to give an insight for everybody to sort of have more, sort of like knowledge about your work.
Sure. So my background is a dental surgeon, and I also did another degree in medical science and management, so how to manage healthcare organizations. And after I qualified as a dentist and I did my postgraduate dental training, I went on to spend a few years in head and neck surgery, so maxillofacial surgery. And that's really where my passion for facial aesthetics started and grew. And essentially, that was a range of treating patients with facial deformities to facial cancers to trauma after road traffic accidents or so on. And after that, I became a member of the Royal College of Surgeons of England and then Edinburgh. And I started my non-surgical aesthetic career because I thought, well, there must be something that we can do for patients that is less traumatic than surgery. Because one of my big interests was facial deformities and facial discrepancies. So when patients are born with either a pronounced asymmetry to the face or an under or overdeveloped jaw that affects them in many ways, not just physically, but also emotionally, they'd have to come in, have a really long journey of treatment, usually 2-3 years long, and then undergo surgery, which is traumatic in its own right. And whilst we had amazing results, I started to think, I wonder if there is something that we can do that is less traumatic. And that's where my interest started to develop in the non-surgical facial sector. And so I started on my training program with that, and that continued up until now, and it's lifelong learning, really. And now I focus the majority of my time and my clinics doing non-surgical facial rejuvenation. And I train as well, so I teach doctors and dentists and nurse practitioners how to do facial aesthetic treatments. And I run a clinic in London and in Liverpool.
Amazing. That is such inspirational work. I don't know how you manage doing all of that, also being a mom and having your own business and doing more than one thing. It's really, really inspiring. I'm really interested in you talking about the aesthetics. A lot of people do have these kind of misconceptions, especially about dentists that now are going into this. And as if to say, some people will come out, I'm going to be blunt as to what I've heard. And even if it's not my thoughts, I want to hear your side of the story and also put people, in their sort of like right mind as to what it really entails. It's like, oh, you spent so many years being a dentist and all of a sudden now you're just injecting people just to get them into a particular, way of looking. And obviously it comes with a responsibility. And I understand that you are trained and it is something to hold dear with regards to even taking care of the well-being and the mental issue of your patients. And I think people sort of like disregard that and they don't speak about it. And I think it's a lot more serious than what people entail. And of course, everyone's doing it now, even if they're not trained in sort of like high, sort of like performance, sort of like, training like yourself. So there is a difference. And I want you to go through that with me. Like, what is the responsibility for doing these aesthetics for the patient, for yourself, as well as the measures that are taken, and how would you undergo sort of like diagnosing if that patient's well enough to continue with more sort of like, these I don't know, Botox fillers and everything else that they need, you know, what is the threshold for that? Because a lot of us do see the extreme side of it and we just like, you know, move away. But there's nothing wrong. Like people say, you know, if you want to have your teeth straightened, why not have your nose straightened? It does build confidence to a certain extent. But what is that extreme and what is that sort of threshold?
Where do you draw the line? You know, great question, Fahima. Thank you. And I think you've touched on a lot of important topics there. One of which is judgment associated with having treatments. The other one is mental health state of patients and how we safeguard our patients' well-being. So the first thing I'd like to cover, and you know, we will cover all of those questions, is I think the dysregulation or underregulation of the market. And unfortunately, the aesthetics industry is very badly or poorly regulated in this country. I would say it's underregulated. So that means pretty much anytime Dick and Harry can go on a day's course and to start injecting people's faces. And therein lies the problem. That is not, one day course is not the same as having a 5-year medical or dental course and years of following training. And the face is a complex part of the body with lots of blood vessels. And those blood vessels connect to important structures like our eyes and our brain. And so complications are serious if things do go wrong. For example, blindness or even stroke. So I think making sure that if you are interested in embarking on an aesthetic journey, make sure you're seeing somebody who is medically qualified with the appropriate training. And the appropriate training does mean lifelong training and follow-up training. It's not a day course and that's it, now we can start injecting. So thank you for touching on that, because yes, I think it's really, really worrying. And we've all seen the fallout of the wrong people doing treatments. And that might be overfilled lips, it might be hamster cheeks, it might be Spock eyebrows. And that's partly because they might not have an aesthetic eye, or they don't have the same ethos as the majority of healthcare practitioners. Now, healthcare practitioners have gone into healthcare to care for your health, which means they're not seeing you as a walking, talking feature. At least that's how I operate my clinic. When patients come to see me, they're not coming, I don't see them as a walking, talking lips or, you know, a set of nose or eyes. It's holistic. And we look at the person behind the feature and make sure that we are treating them holistically and understanding who the person is behind that feature, behind the smile. And I think that's really important, that we provide that 360 assessment and 360 healthcare. So that's another thing. Now, you've also talked about dentists going into facial aesthetics, and is it a shallow field? And, you know, you've trained all your life doing dentistry and now you're going to do facial aesthetics. And this is something that I hear quite a lot, actually. So it's not surprising. And I can understand it. And I don't blame it, because people don't know what they don't know, right? Exactly. So they've got a blind spot, and so they're seeing that and not really getting that actually the mouth, yes, we're trained in the mouth, we're trained in the dentition, but the rest of the face is part of that. The mouth is part of the rest of the face. So for me, it's an extension of dental surgery. And also coming from a head and neck surgery background, I was treating the face and neck, the head and neck area. So it's very, very natural progression for me. And when it comes to patients who come in for treatments, the way that I run my clinic is I have an overall ethos of natural looking enhancements, but I would say normalization before beautification. And what I mean by that is the majority of the work that I do is reconstructive and restorative in nature. And yes, we enhance patients' aesthetic appearance, but I don't believe in distorting. And if a patient came in and said, I want big lips, I don't just say, okay, sit down, here's your big lips. It's why? Why do you feel you need to have that done? Will it even suit you? And I think that's a really important conversation to have with the patients, because we have to be mindful of their mental health, their what is driving their request for treatment. Do they need it? Is it going to empower them? Is it going to impact them positively, both in an aesthetic term? Does it suit them? You know, not everybody suits Angelina Jolie lips. I wouldn't get away with it. You know, so I think we have to be mindful of fads. And particularly our generation, you know, and I think with the boom of social media and Instagram and all these people coming out with big lips, suddenly we had everybody wanting big lips. And I found myself in a moral dilemma. That's not why I went into the field. I went into the field because I wanted to empower people. I wanted to help them and treat, you know, their skeletal deformities or discrepancies in a straightforward, affordable, reduced downtime type of treatment. And I really strongly believe that these things done correctly are so empowering. And that's not to say have treatment to get confidence, no. But if you have crowding of your teeth and you're not going to smile, and we hear this all the time, patients going to say, I won't smile. Even when they're talking to us, they're doing this. They'll never smile in a photo, and it impacts them socially every single day with every single social interaction, be it personal relationships or work relationships. And even in interviews, they won't go for job interviews, or they won't go for promotions because, or they don't want to be client facing because they don't want to smile. And I strongly believe everybody has the right to express joy and to feel free in enjoying life and participating in life fully. And so we have no judgment when it comes to teeth. You know, if you have braces on, it's the norm. That's very accepted. Even teeth whitening, yes, I understand. But when that's crowding, or when, you know, crooked teeth is fine, but if it's a crooked nose, suddenly there's a stigma. That's vanity and that's shallowness. And in my experience, and my personal opinion is, no, it's not. And I don't think it's for anybody else to judge the person that comes in. I think having had these conversations with my patients, many of them will come in saying, again, I will not go to have a job interview. I will choose back office work rather than front office work because I've been bullied as a child because of my nose. I will have my hair in a certain way or my scarf in a certain way. When I'm driving, to the point where even when I'm driving, if I know that there's a traffic light coming and the red light is coming, I'll just hold back so that the person in the car next to me can't see me on the side. And they often tear up when they're telling me this. So you can see that it's something that is affecting their well-being and limiting their ability to freely enjoy life and completely enjoy life. So in those kinds of circumstances, I believe treating it, and again, reconstructing rather than doing it for the sake of a fad, is fully justified. And I have seen the empowering benefits that has. Patients come to see me a year later and say, Dr. Yusra, you know what? It's not even about my nose, but I finally feel free. I can find it. I feel happy. I'll be in my family photos. I'm smiling more. My mom and dad love it because they know, they can see how much happier I am. So it's the emotional impact that really is why is my purpose. That's my why, because I know that this is empowering their health. And for me, it's an extension of dentistry. It's not a shallow aspect. But I think, I think that I can understand why people would think that. And I think you internally and in your own clinics, and every clinician needs to be mindful of the fact that, that, like I said, there is this fad. And are we doing it for the right purpose? Are we doing it to benefit the patient's health? Or are we actually putting the patient at risk for no reason? And all they need is a little bit of empowerment and self-love. So, I have no qualms with turning patients away if they don't need a treatment. I routinely do. Every single day in my clinic, I'll say, you really don't need this treatment. And instead, the consultation will sit there and we'll have a really long life discussion. And they walk away, sometimes not having any treatment, but feeling so much better. So we are not just injectors, we are not just dentists, but we are providers of healthcare. And healthcare means looking after our patients, their mental health and their physical health. Now, in terms of mental health, I think that plays a big part, particularly in aesthetic procedures. And the reason why is because we know that 15% of patients who seek aesthetic treatments have body dysmorphia, okay? That doesn't mean that if you come in for treatment, you've got the body dysmorphia. No, but we have to do an appropriate screening. And that's why every person who's going to go into this field needs to do appropriate postgraduate training in mental health and psychological assessments. And that often comes in the form of, in my clinic, every single patient will be given an anxiety questionnaire so that we pre-screen. And then when they come in, it's not just a questionnaire, they come and we have a discussion. So to what extent does this impact you? Are you making the right decision right now? Is this an emotional decision because you've just had a big breakup? And, do you have the capacity right now to consent? Do you need a cooling off period? And so that forms a part of every single consultation. That's part of the screening process. And that's a really, really important thing to do, because you don't want to take advantage of people's vulnerabilities. That's neither ethical nor is it going to serve you any purpose. And one of the most important aspects, in my opinion, of aesthetic medicine, aesthetic dentistry, is knowing when to say no. If it's not going to benefit the patient, or if it's going to make them look like they've got hamster cheeks or overdone lips, or it's going to distort, it's going to negatively impact them, even if they want to, even if they say, yeah, that's what I want. At the end of the day, you have a responsibility to safeguard that patient. And so you've got to say no, you know? And I think that's a really, really important thing. And I think it's because clinicians sometimes feel disempowered, or sometimes bullied, or for commercial reasons, feel that they won't say no. That's why we have the distorted faces, and that's why people have a bad image of aesthetic procedures, and they think Botox, oh no, I don't want to look like Spock. You know, lip fillers, oh, I don't want to look like a duck, because they've seen that. We've all seen that, right? And so we associate lip fillers with looking done. But good aesthetic medicine is actually undetectable. It just enhances you. It makes you look like a better version of you. And the idea is it's not shallow. It's not come in to make you look like a better version of you. We want patients to walk out with a bounce in their step, and, you know, to look good, not done, to look fresh, not fake. And that's something that I am very vocal about. And thankfully, all of the clinicians in my practice emulate that ethos. So it's we're not afraid to say no, and I think it forms part of the assessment, and it's a really important conversation to have with our patients.
I think you've highlighted something really important. I don't think anyone's talking about it enough. And like I said, because everyone has this limited mindset and limited knowledge as well, like you mentioned. I know myself, you know, dealing a lot with, you know, helping people with their self-esteem and confidence is one area as well. It's obviously from the inside, but I also do believe that when certain people do take steps, for example, they eat well and they exercise, you know, it releases certain chemicals, and as well as having that outlook of yourself. We're not trying to impersonate anybody, but it's just like you said, is bringing out that best version of yourself. If you were to have clearer skin, you know, better diet, nice bright eyes, you know, white teeth, whatever it may be, it can actually make some, you know, adjustments to your everyday life. But if you were to go deeper, if you were to go deeper, there are also the distortion of the human mind, that no matter how you might view something, that actual person does not view it. Just like how when someone's anorexic, they still think they're fat. It's the same with their lips is not big enough, or their nose is not straight enough. So it's good that, you know, we have someone like yourself that is trained and is specialized and is responsible, and it's safe for anyone to come. And I'm so proud to have guests like yourself come in, because it's of a different caliber, and people need to be more aware of this, you know, because you are a safe space to go to, and you're not just going to go there just with, you know, the client's needs and wants without actually full assessment. And that's what I want to highlight, because I've always believed this, and I've just never had a conversation about it. And despite what people think that, oh, you should grow old naturally, that's fine if you wanted to do that, but there are other options. Just like how if you wanted to, like I said, have, you know, clearer skin, for example, it is the same thing. But yeah, you also do have, you know, sort of like an ambassador for certain products as well, which I've learned looking at your page. So, I mean, okay, now we don't really know what to do in this lockdown with Botox and filler. You can probably give alternatives online, even with products. So what are patients doing when they can't have these injections? I mean, are there alternatives? Because it's only, you know, a few months for Botox, and, you know, maybe like 8-9 months for fillers, right? And maybe 2-3 months for Botox. What do you do after, you know, and after that time wears off?
Great question. So with regards to Botox, yes, it lasts about 3 months. And dermal fillers it depends on which dermal fillers you use. They can last approximately up to 2 years. So there are long-lasting fillers. But just because patients can't come in doesn't mean that they can't do something, you know, to look after themselves at home. And like you said, yes, I'm a key opinion leader for a company called Obagi Medical, which is a medical line of skincare treatments with over 100 different products, depending on what the patient needs, what the underlying skin condition is, and what we're trying to treat. So we have seen a huge surge in patients contacting us for skincare at this time. And I think that's for a number of reasons. One, they realize that actually that's what they can do to continue looking and feeling good. Two is because a lot of people sitting at home are stressed right now. COVID is stressful, it's scary, it's the unknown, and that heightened cortisol is having an impact on their skin, and it's wreaking havoc on their skin. And again, it's a negative cycle, isn't it? Because your skin looks bad, you feel bad, you feel depressed, and then your skin gets worse, and so you're stuck in this negative cycle. And we know that this is not Dr. Yusra's theory. This is scientifically proven, tried, tested. We know that acne is associated with higher incidence of depression. So we can't just say, oh, you're just shallow, just go and see a psychiatrist, or go and get some CBT. No, there's an underlying pathology. Treating it makes people feel better. So what can they do? Lots. Getting on the right skincare program, I think, is really important. There's something to be said about not overusing the wrong products or not over cleansing. Some patients with acne feel that they need to wash their faces 5 times a day. You don't need to do that. Wash your face morning and night effectively with a cleanser that is gentle on your skin, so that it's not breaking up the skin barrier function. Because if you're overly aggressive on the skin, you're going to be compromising its ability to function optimally. So you want to be gentle enough to maintain what it needs to do. So the skin, we say it has a barrier function. So it's got these cells that stop bacteria coming in and stop water coming out. When you over exfoliate and when you put the wrong products on or the wrong makeup on, you're stopping the skin's ability to function properly, and then you get breakouts, redness, dryness, sensitivity. So start gentle, go simple. Wash your face morning and night, never sleep in makeup. Number 2, I would suggest to all my patients use an antioxidant serum in the morning. The reason why is because we're surrounded by oxidative stresses, pollution, sunlight, etc. And so an antioxidant will protect from the free radical damage of the sun. And there's a lot to say about sun. Yes, sun is great, but actually 90% of premature aging comes from the sun. And I know a lot of people who still don't believe that. And again, this is not my theory. This is tried and tested. We know this is medically proven. And the sun's damaging rays come rain or shine, even when it's snowing, even when it's raining, even when you're sitting at home, it comes through in the window. And there's 2 different types of UV rays or sun rays. One is called UVA, and I always say think A for aging, and UVB, think B for burning. Now in the UK, we don't get a lot of UVB, so we don't burn. And therefore people think, oh, there's no sun, there's no need for SPF. But actually the UVA, the rays that are coming through that are causing us to age, that are causing our cell structure to break down, that is coming through all the time. So wearing a high quality mineral SPF every single day, come rain or shine, is going to be the number 1 preventative measure that you can do at home. And then I would suggest to anybody over the age of 25, start to use a retinol, because a retinol is a great ingredient, again, scientifically proven, gold standard, that stimulates cell turnover, improves the collagen density in your skin, thereby delaying aging, reversing sun damage, improving fine lines and wrinkles, improving pores and texture. So these are things that patients can do at home. They don't necessarily need interventions.
Would they see the results? How immediate if they were to use something like this?
It depends again on what the skin is currently like. We have treatments for patients who have pustular inflammatory acne that are so effective they'll see a difference within 10 days. So you tend to see a difference start straight quite quickly. And the reason why is because the medical grade products are very different to high street products. And what I mean by that is in this country, and I believe in the US, there is a limitation by the government to say that the products you buy over the counter cannot change the cellular structure of your skin. In other words, they're only working on the upper layer of the skin called the epidermis. So they're not working on the dermal layer. And deeper down where the dermis is, that's where all the collagen stimulating cells are. So if you're putting something on, it feels great. You think, oh, this feels nice. It's not actually doing anything for you. So to me, I liken it to money down the drain. I would rather pay that extra £10 and get medical grade products that are going to penetrate right down to the dermal layer, start to stimulate cell turnover. And because of that, people see an impact quite quickly. And with every skincare regime, you really need to be consistent. You should be on any skincare regime for at least 3 months. And I would suggest, look, not one size fits all. Your skin is going to be different to my skin, which will be different to the next door neighbor's skin. Have a skincare consultation. So we have a virtual clinic at the moment. We're offering video consultations so we can assess, what are you doing at the moment? What's your skincare like at the moment? What's your skin concern? What's your nutrition? Because nutrition impacts skin. So, what are you currently doing in terms of, are you taking any extra supplements? There's a lot that you can do that can empower your
Are
skin
you
to heal.
are you able to actually do these consultations online successfully? Because normally, do you have to get close up to actually monitor the skin and see the skin, or is virtually enough?
You know, this is a question that we were really concerned about when COVID happened, because we thought, how are we going to do appropriate skincare consultations? You know, usually we're
Yeah.
looking under quite close up or under a microscope, but you would be surprised actually the amazing technology of iPhones and the camera quality. It's really really
That's
good.
true. Without
So
filter.
without filter, without absolutely. So we say to our patients, listen, turn up to your video consultation, bare, no makeup, and then we ask them to take close-up photographs and send it to us as well. And often we can see when they've got acne, we can see when they've got pigmentation, we can see that they've got open pores, and they communicate to us their concerns. And then we have the photo sent to us as well. And we tell them to get somebody to take it for them. And the iPhone camera is amazing, as is the majority of this generation's cameras, fantastic quality. So we have been absolutely fine, and we've witnessed a lot of skin transformation. So people are doing a great job with their skincare at home. And also some of the skincare programs that we do are they're medical grade, so they can be intensive. And some of them include a skin peel. Now, traditionally, people are very worried about doing a skin peel because they think my face is going to fall off. I've got client meetings. I've got to go to work. So all of a sudden, everyone wants to do a skin peel because they're behind closed doors. So that's great, and it's great that we're there on the other end of a phone to say, if
Can
they're
you do
worried.
a skin peel? Can you do a skin peel like this? Like, can they do it themselves at home?
Yes, but it's prescription. So only a doctor, only a prescriber can prescribe it for you. So it's done under the supervision of a prescribing clinician. They will send it to you, they will tell you how to use it, and then they will monitor your progress. So as long as it's under the supervision of a doctor, you can't buy them over the counter, no, but you can have them as a prescription from your doctor, and you apply them according to prescription.
This is such information which is, I think, so vital for everybody right now. We think that I'm very much, obviously, as you know, as a life coach, and understanding human behavior and mental health generally and well-being. But I feel that, yes, it does coincide with, like you said, it's a holistic thing. It's not just the mind. It's a combination. Obviously, we have to look deeper within ourselves as to where these things do come from. But having someone like yourself to help with enhancements and really does, take care of, of an individual's well-being. I also want to go back to the dentistry. I mean, are there anything that you could do like virtually with that? Because that seems to be something that during this lockdown, unless it's an emergency, that you actually are seeing patients. So what could you do virtually if you do have any problems and issues? And what are the kind of problems and issues that you can sort of consult online?
So we can't consult online per se. What we can do is we can guide you on how to look after your teeth. So make sure that you're brushing your teeth morning and night every single day, removing all the plaque, flossing in between the teeth to get rid of any food that's stuck in there that can exacerbate problems. So appropriate cleansing will make a massive difference. But when patients are in pain, traditionally they want to come and see a dentist, and right now dentist doors are closed. So your first port of call is still your dentist. You need to call them because they will have your x-rays, they'll have your records, and they'll know you usually, and they'll be able to guide you and understand what is likely to be going on. If you do have pain, your dentist will then decipher and diagnose what is the underlying problem. And if you have an infection or you're in severe pain, then they can prescribe antibiotics remotely, so via video or a telephone consultation. And if you need a tooth out or you've got an abscess, then there are some emergency centers open that can facilitate that. But it's certainly not easy. I would say if there is things that you can avoid, if a crown has, for example, fallen out and you're not in pain, then that is something that your dentist can guide you on how to fix back up on your own.
Oh,
So you
wow.
can get, you
Super
can
good.
actually get, well, not super glue. I would say definitely not super glue. I mean, we're going to have a whole host of problems now with COVID finishes because everyone's going to come with super glue teeth back. But there are temporary cements that are available from the likes of Boots, and then the patient can buy it. We will tell them, or your dentist will tell them how to mix it, and then apply it onto the crown and stick it back in. They're very effective in the short term. So, they're not meant to last 6 months, a year, but they'll get you through the short term until hopefully the dental surgeries are open again. And then you can go and see your dental surgeon to help you.
That was so amazing to hear you speak, and especially giving so much information about aesthetics. I think that a lot of us, need to sort of wake up and have a little bit of an open mind and be less judgmental about people that are in the sort of like sort of medical field, as well as the patients that are actually having these treatments, because we don't know what's inside that somebody who's going for it, and it can actually make a huge difference and impact to someone's life. And it's not shallow, it is just someone who just needs that extra boost. And just like how you would with a thought in your mind, you can actually also do that by wearing nice clothes and fixing your teeth. And even, if it means, doing something to your face structure to help that confidence, it is just the same, like you said, as an extension. So I hope this, the show will be really sort of like very vital news, and give that real sort of like information for people to take away and not misconstrue whatever it is that they have in their minds. Is there anything else? I mean, I really want to keep you on for so much longer, but we have come to the end of the actual conversation. But any final thoughts and words before we end? And I will have all your details in the description box. Please, if you are wanting to contact Yusra, please do so. I will have her details on there. I'm sure, even though she's so busy, she will definitely take your consultation calls and see to any of your needs. So basically, I want to obviously, promote this, because I think that, the more people have responsible, trained professionals like yourself, is probably going to spread the word in the correct form when they're going to be coming to, using aesthetics in any sort of way. So
Yeah.
yeah, any final thoughts or words from yourself before we end?
Oh God, I could talk about the subject for forever.
Well, I'll have you on again, don't worry.
With regards to finding the right clinician, I think that's the most important thing. And there are so many good clinicians out there. There really are in all parts of the UK. I don't know where your audience is, but if they're in the UK, there's so many good clinicians out there that are ethical clinicians. And that's really what you need. You need someone who's going to safeguard your well-being and put your interests first, and not being afraid to say no. That's a really, really, really important quality in a clinician. And understanding that what we're doing as healthcare practitioners is, yes, we might be beautifying, we might be enhancing, but it's very much about normalizing. And I think, this idea of dermal fillers, Botox, injectables making you look distorted, that's 2008. That ship has sailed, and a lot of patients have come around the other side. A lot of patients actually come in and they don't want that anymore. So that's really something to be celebrated. That's the good news. And I think if you are concerned about something, be it acne, be it crowding of your teeth, be it a facial asymmetry, an underdeveloped jaw, an overdeveloped jaw, a crooked nose, yes, there's going to be judgments from the outside, but that's because they don't know what they don't know, and they've got that blind spot and they can't understand it. But this is about the person, the individual, and how it's impacting them and how it's holding them back. So if it's something that you feel is holding you back, have an honest, open consultation with an ethical practitioner who'll be able to guide you. And they may well say to you, listen, you know what, your nose is gorgeous, you don't need treatments. And that's all you might need to hear, to be able to walk away and accept that. And on the other hand, if it's something that you can treat and it's going to empower you to live your life fully, then don't feel afraid to explore that option. There are non-surgical options that are safe, that are effective, and there are fantastic clinicians out there. So do your research. And thank you so much, Fahima, for having me.
No.
You're an incredible life coach, an absolute inspiration to be around. Your energy is gorgeous. And thank you. Thank you so much.
No, thank you. It's my pleasure, honestly, and I appreciate your kind words as well. I definitely will be having you at some point at another time, I'm sure. And I really, really, again, I would recommend Dr. Yusra. I'm not being biased. I know her credentials, so please do contact her. All her details will be at the bottom of the box. I hope that you had a really, really good time with me, because I certainly did. Thank you so much, for Yusra, for your time. Thank you, viewers, for watching, and I will be back with another show soon. Take care, stay safe and well. Bye.
Bye.